Alright, okay. So, hello dears. Ayan. So, hello and welcome now again to the continuation of our lecture on HIV serology. And for this video, we're going now to start discussing on the different laboratory tests to diagnose HIV infection. Okay? Alright, so where do we come in the picture as medtechs? Okay? Alright. Now, for the most appropriate specimen nato is blood. Of course, it's all blood. May it be serum, plasma, whole blood, or filter paper collected blood. So, all those specimens are accepted. Basta gikan sa blood. Okay, blood. Alright, alternative specimen can only be saliva or urine because they contain low amounts of antibodies. Okay, so if lisod kuhaan og dugo siguro or wala na blood or lisod kuhaan or dili ka kakuha, no? So you could also opt for saliva or urine. But again, ang first choice gud nato, the first specimen of choice nato is blood. Okay, blood. All right, okay. Now, there are 4 types, generally, major types of laboratory tests in diagnosing and monitoring HIV infection. You have, of course, first is CD4 T-cell enumeration. Next, you have antibody detection, antigen detection, and lastly, the viral nucleic acid testing. Okay, now, for CD4 T-cell, guys, and viral NAT, or viral load, these are usually used for monitoring. Okay, so for monitoring the course of infection, di ba? And for antigen antibody, we also use that for diagnosis. Okay, we can use that for diagnosis. Okay, even CD4 and viral nucleic acid testing, usually, they can also be used for diagnosis. But generally, ang CD4 T-cell and viral nucleic acid, they are usually used for monitoring yun. Okay, monitoring. Okay, alright, ayan. For tests that detect HIV, we have things to consider. The specificity, diba? Again, when you say specificity, it's the level, no, up to which the test can detect the antigen or the pathogen that we want, that specificity. And sensitivity is the level up to how, the ability of the test, rather, to detect the analyte even at the lowest concentration yun niya, diba? That sensitivity and specificity. So that's in your clean chem na I'm sure din naman na differentiate na maayo. So I hope din mo malibog ana. So specificity again should be at least 98%, but we want the sensitivity should be 100%. Because even if natay dili 100% ang specificity, taas ra gyapon siya, but we want to make sure that it's sensitive because even if at low unsa kagamay na concentration, ma-detect yapon siya. Because early diagnosis of HIV is very important para maagapan dayon siya, para dili siya mo progress to the later part or to the late stage na gyud, which is AIDS, di ba? So, very important gyud na sensitive. Bahalag low concentration pa lang, ma-detect na siya as early as possible. Okay, that's why dapat the sensitivity is 100%. Okay, and invariability reading must not be over 10%, meaning ang invariability, meaning ang difference, no, like from one test to another, dapat gagmay ra ang differences. Okay, di kayo na nakadako, dapat dili mo greater than 10%. Okay, alright, so we'll start first with the first one, which is of course CD4 T-cell enumeration. Because again, the hallmark of HIV infection is AIDS lymphopenia, or hallmark feature of AIDS is CD4 lymphopenia. By the name itself, lymphocyte, penia, decreased concentration in blood. So CD4 lymphopenia, hallmark feature of your AIDS. Enumeration of CD4 T cells played essential role in evaluating the degree of immune suppression in HIV-infected patients. So we then can know kung unsa na bagid siya ka-intense ang infection, okay, or how intense or how severe is the immune suppression of already in the patient. Okay. Gold standard is, of course, flow cytometry. We have mentioned this in our discussion on T-cell enumeration assays, diba? So since you're detecting CD4 T-cells, diba? So na-probe, no? Fluorescent probe on the CD4, no? And then they pass through single line, diba? Hydrodynamically focusing. Okay, that's on our lecture. Na-lecture na ito sa T-cell enumeration assays, no? And the CD4 cell count, the normal should be 450 to 1,500 cells per UL. And ang AIDS is less than 200 per UL. Nako, malabas sa boards din. And you have also, we can use the CD4, CD8 ratio. The normal is 2:1. So mas daghan jud ang CD4 compared sa CD8. But in AIDS, ni-reverse. Mas nigamay ang CD4 kaysa CD8. So 0.5:1 or 1:2. So mas nidaghan ang CD8. So that could be telling of an HIV infection. So we could use, usually ang CD4 cell count atong gamiton, or we could also use a CD4, CD8 ratio. Okay? So again, CD4 CD8 ratio normal gyud is mas daghan ang CD4 kaysa CD8, but in HIV infection ni change siya, na reverse ang ratio. Mas nigamay ang CD4 kaysa CD8. All right. Now in patients with less than 200 per UL of CD4 cell count, they're given already prophylaxis for pneumocystis, Urovet C, prophylaxis for pneumocystis Urovet C para di sila magka-pneumonia. And if less than 50 nagyod iyahang T helper cell, prophylaxis this time for Mycobacterium avium complex na infection. Still the same to prevent pneumonia or lung infections. Okay? Kung less than 200, prophylaxis for pneumocystis Urovet C. Kung less than 50 na, then you're given prophylaxis for Mycobacterium avium complex. Again, these are all opportunistic infections, opportunistic pathogens. Again, brought about by immune suppression or immunodeficiency. Okay. Yeah. Okay. All right. Ayan. So that's for CD4 T-cell count. Now, we have also stages of HIV based on CD4 count. This is based on adolescents and adults, but for like napoy staging, different po ang numbers of the CD4 cell count sa children, less than 1 year old, mga infants. Okay, but ako lang i-choose ang adults and adolescents. So we have 5 stages. Stage 0, early HIV infection, normal pa yung CD4 count. Stage 1, greater than equal to 500 na lang, or ang percentage nimo is greater than equal to 26. No AIDS-defining condition, meaning wala pa kay pneumocystis infection, wala pa kay candidiasis, ganun. Stage 2, you have 200 to 499, no AIDS-defining condition. Stage 3, less than 200 na, or nanay AIDS-defining condition, so you're starting to develop na mga pneumonia, Kaposi sarcoma ba, ganun. And stage unknown, no data. So walay data pa, okay? And no information on presence of AIDS-defining conditions. So you have 5 stages there. So ang pinaka-ano yun is stage 3, less than 200, and then you develop na AIDS-defining conditions. Okay. All right. So that's for CD4 T-cell enumeration. Now we go now to, of course, the next one is antibody detection. Kung sa ganitong antibody, the first antibody to increase or to be detected in HIV infection, press the buzzer, it's antibody to P24. But again, according to Stevens of 4th edition, pinaka-recent na Stevens, GP41. But unsa tong answer? P24. Okay? All right. Ayan. Okay, so again, that's for the first antibody to be detected in HIV infection. So we go now to the different tests to detect your antibody to HIV. So serological tests are also used to detect or develop to detect antibodies to HIV because most individuals will develop antibodies 1 to 2 months after exposure. So very, very madali din naman, no? Okay, very early din. All right, so we have 2 types. We have the screening tests, which we can use either Elisa, okay, Skyler, charot lang. Elisa and rapid tests. And you can also have confirmatory tests, which is, of course, your Western blot, okay. Indirect immunofluorescence assay, IFA, radio immunoprecipitation assay, and line immunoassays. Ayan, so dito na. Welcome back, mga labeled immunoassays. Dito na sila, okay. Andito na sila. Nandito na si Chito. Charot. Okay. They are here now. Alright. Muna ni siya. Okay. Alright. So we start first with your screening test, which is your ELISA. Now, they have different generations, no? So, na siya boomer, millennials, Gen Z, charot. Okay. Of course, the first generation ELISAs, diba? We have already discussed ELISA, diba? Antigen, solid phase, and then you have antibody, and then imo siyang i-coupled with an enzyme-labeled antibody. Okay, and then substrate, then color, usually color reaction. First generation ELISAs, you only detect anti-HIV-1 using HIV-1 antigen. So, sa imuhang test medium or sa test tube, you have physically adsorbed HIV-1 antigens dito. Okay? And then you add the serum which contains anti-HIV-1, and then they react, and then after washing, you then add your substrate to the enzyme, and then I color reaction. If na-added to ang if nakabind ng enzyme label to the antigen-antibody complex. Okay. So first gen, only anti-HIV-1 ang ma-detect na antibodies. But this is prone to false negative, tama ba? False positive reactions due to HLA or human leukocyte antigens or other antigens found in the antigens that Because again, cultured HIV-1 man na siya, meaning gi-culture siya using artificial procedures. So, basin na daw mga antigens na na-appeal aside sa kailangang ma-test. So, it's prone to false positive. And because of that, nag-develop sila second generation. And ang first gen po, di siya makadetect og antibodies to HIV-2. So, they then developed second gen ELISAs. And these second gen ELISAs, they now detect HIV-1 and HIV-2 using recombinant or genetically engineered HIV-1-2 antigens. Now, very good, kaya na-improve ay muhang specificity and sensitivity because it can now detect HIV-1 and HIV-2 antibodies. But ang downside lang kay, wait lang. Okay, the sensitivity is quite decreased because it cannot detect antibodies, other antibodies that were not or that cannot react with these genetically engineered HIV-1-2 antigens. What if there are different antibodies found in the blood of the patient that are of dili siya same with the genetically engineered HIV-1-2 antigens. So naa mo na siya hang disadvantage lang, okay? And because of that, they then develop your third gen ELISAs, which now detects HIV-1 and 2, but the difference lang is it can now detect different antibody classes. Ayan. So, because of this, the diagnostic specificity is 98% ba yun? And the sensitivity is, tama. The diagnostic specificity na is 99.9% and sensitivity is at 100% because it can already detect a lot different antibody classes, even to different mga subgroups of your HIV-1 and 2. So, that's the of the third gen. Okay? And wala siya kung sila nahuman, they developed fourth gen ELISAs, which can now detect even an antigen, which is your P24. Not only anti-HIV-1 or not only antibodies to HIV-1 and 2, but also an antigen, which is P24 in your HIV-1. So, na-incorporate na siya in one test pa lang. So, it's very economical, very cost-effective. Kaya usa lang ka-test, you can already detect a lot. Okay? Alright, ayan. So, that's for ELISA. Again, a screening test ni siya. Okay. Alright. Aside from ELISA, you could also use rapid tests. And by the name of rapid tests, ideal siya in resource-limited settings, Exhibit A, Philippines. Okay? And in situations which fast notification of results are required. So, it could be flow-through assays or lateral flow immunoassays or atong immunochromatography. Yes, and this is our lab activity in HIV serology. We'll be using test kits, okay, to detect antibody to HIV-1 and HIV. I think HIV-1 and HIV-2, yes. So, by the name itself, diba, pregnancy, immunochromatography kits, placed on one end, and yes, yeah. They will then reconstitute the HIV antigens and complexes and bind to an enzyme-labeled conjugate. Yes, yes. And then you have a colorimetric reaction, colored line or dot. So, so for illustration purposes, diba, immunochromatography, later di mauna ko. So again, when antibodies, IgG ba, IgM, RGA to HIV-1, HIV-2 are in the sample, they bind with the recombinant HIV-1 or 2 antigen na naa dito. So, you have antigens for HIV-1, GP41 and P24, and for HIV-2, GP36. Colloid gold conjugate. So, combine siya og colloid gold para mas stable siya, conjugate. The complexes will be captured by your HIV-1 capture antigen on test line 1 and HIV-2 capture antigen on your test line 2, forming visible lines. So, for illustration purposes, ito na. So, these are your antigens, no? For HIV-1, GP41 and P24, yes. And you have HIV-2 na recombinant antigen. And of course, control is an antibody, anti-HIV, from a goat. Okay, goat anti-HIV. Now, for the sample, your sample may contain na HIV-1 and HIV-2 antibodies. So, green ang anti-HIV-2, blue ang anti-HIV-1. Okay, now, of course, diba ang flow is padulong diri. Okay? So, it will now attach, okay, to the specific antigens na iyahang reactant, which is your HIV-1 or HIV-2 na antigen. Ayan. So, they will react. So, of course, since napamay free na binding site ay mong HIV-1 antibody, so ma-catch siya by your antigens in the test line 1. Okay? And of course, still the same pod with your test line 2. Okay? And the remaining antigens here, kay antigens pa nang nasa mong reagent, they will be captured by your GOAT anti-HIV sa control. So pag add sa substrate, Japon sa test kit, they will now produce a color. Okay? Alright, which is then will be seen as colored lines or dots. Okay? Alright, so muna bahalag, di ba naka-mention ko na bahalag negative, your control line will always be, always have a color reaction. Why? Because it's the reagents na sobra, diri, na wala ni react. Okay? I-capture agyapon siya by the specific antibody or antigen ba diri. In this case, antibody, yung i-capture tong sobrang antigens na reagents. Alright? And they will then form a complex and then color reaction. Bahalag negative ang sample for the antibodies, na adyo japoy line ang control. Okay? Dapat yun na line ang control, kaya if wala, bahalag unsa pa result diri, it's invalid. Diba? Okay. Alright. Ayan. So that's for immunochromatography. Okay. Now, for antibody detection for Western blot, which is considered to be the gold standard again, for many years na, gold standard test for the detection of HIV, your Western blot, also known as enzyme-linked electrotransfer blot technique. And diba, it's also a modification of unsa na precipitation method, immunofixation, diba? IFE, immunofixation electrophoresis. It's a modification of this, ang Western blot. Diba? Again, confirms, it's usually used for confirmatory, the presence of antibodies to specific antigens after detected by screening, either ELISA or rapid tests. So if mo positive siya sa screening, ELISA or rapid test, imo siya i-subject judayon dapat to Western blot. That's the algorithm, that's the testing procedure na gi-follow for many years. Okay, but there have been changes now, which we'll also look into later. Okay, after Ani. All right. So it's only performed by adequately trained laboratorians. Positive and negative control sera should also be included. By the name itself, negative control, no bands, and positive control, reactive with these protein antigens or with these antigens. As you can see, mga structural proteins pa rin, okay, or mga proteins found in the virus, found in the HIV. Okay, all right. Now, for HIV positive, you're considered HIV positive in Western blot if at least two, ayan, at least two ha, so meaning two ang minimum, of the following bands will appear: P24, GP41, and GP160/120. So any of the two, P24, GP41, appears lang duha, positive. P24, GP160, 120, positive. GP160, 120, GP41, positive. Kung GP41 na usa, then that's negative. Dapat silang duha, at least duha ang mo-appear. Okay. So antibodies to gag proteins, they appear relatively early after exposure, and then they decrease or become undetectable. And your antibodies to GP41, they appear slightly later, but remain throughout all the disease stages. More reliable indicator in the presence of HIV. So, chakta na di akong giingon. Antibodies to P24 ang first yun mo increase, but they then decrease and remain undetectable. Whereas ang GP41 o mga GP120, 160 na antibodies, sila mo sunod, and then sila mo persist throughout of the disease stages. And they are more reliable in the indication of the presence of HIV. Okay, chakta na akong ingon. Yes, Mark. Okay, all right. Antibodies to Pol proteins P51 and P66, they're also commonly detected. Okay, all right. Now, for Western blot procedure, your HIV proteins, they are put in actually parang test strip, no? And they are separated by electrophoresis already. Okay? And they are blotted onto the test membrane. So, separate sa dani mong HIV proteins, no? Into, or HIV proteins by using electrophoresis in PAGE, polyacrylamide gel electrophoresis. And after a while, after separation by electrophoresis, they are put in a test membrane. Okay? Alright, nitrocellulose or nylon strips. Then the test strip is allowed to react with the patient's serum and incubated. Unbound antibodies are removed by washing, diba? So, because you're detecting antibodies man. And then you then add an AHG with the enzyme labeled, and then the substrate, you wash again to remove the unbound AHG or conjugate, and then you then add a substrate which then produces a chromogenic reaction. So basically same siya sa IFE, but for IFE magod kay stain imuhang ibutang, all right? But for Western blot, what you use kay AHG na reagent with enzyme labeled AHG, okay, and then you add the substrate to produce a chromogenic or color reaction, okay, which is in the appearance of colored bands. Okay. So here's an example. So that's a negative control. As you can see, walay bands. Positive control, positive sa taning mga proteins. So muna siya i-color sa yung bands. And this one is called indeterminate, meaning usara ang ni positive. Okay, ayan. So, ayan. So ang positive control, letter A, silang tanan positive. For letter B, indeterminate result. Indeterminate result, why? Because ang ni positive ra is P24, okay? Siya rang usa, together with P55. But again, P55 is not included in the criteria for a positive HIV result, diba? Whereas for positive, ang naa is P24. You also have here, mas klaro diri. So positive result letter C, P24. You also have GP41 and you also have GP160 and GP160 kay baga ang band. Okay. So as you can see, at least 2. So silang tulog yun naa. So at least 2. They fit the criteria to be considered an HIV positive result. So therefore, muna siya positive. Again, letter B, indeterminate siya rang usa. Usara of the 3 na dapat naa ang ni positive. In this case, ang sarang may positive, P24. So as you can see, di ba, usually ang positive kaning baga og bands. Okay? But again, di ba, one of the disadvantages of immunofixation then is that you need expertise to interpret this. And again, as mentioned, Western blot is performed by limited number of laboratories lang. Because again, it needs technical expertise, it needs training of the people. And aside from that, also mga reagents and materials to use. Okay. Alright, take note of those mga limitations sa imuhang Western blot. Okay, alright, ayan. Okay. Now, for the next video, we're going to continue pa rin. Hopefully that's the last video na to the remaining tests for HIV serology, for diagnosis of HIV. And then, yeah, we'll start first with antigen detection and then until to the end, nagyun. Hopefully. Okay, muna na siya last. Alright. Okay, so I'll see you on the next video, guys. Okay.